Talk Club presents Hindi to Fake News with Teacher Marge. Awareness and Information Campaign Series. Hi everyone, we are back with a new video to our Information and Awareness series Hindi to Fake News. So for today's topic is Apraxia. Okay, so you probably have came across the term from your speech pathologist or your developmental pediatricians, and today we are discussing what is apraxia. By definition, apraxia of speech or AOS is a neurological disorder that affects the brain pathways involved in planning the sequence of movements involved in producing speech. That is from the National Institute of Health in the USA. So there are three important points from this definition. First, it is neurological. Then it's a problem involving planning and the production of speech. So let's define and learn more about these important terms. Firstly, apraxia is neurological. When you have apraxia of speech, your brain knows what it wants to say, but it cannot execute. Okay, that is why, because there are planning difficulties. Your brain cannot send the correct signals to properly plan and sequence the required movements. For example, you want to say the sound pa. That is pa. A simple pa sound requires different movements in your body for you to be able to produce the sound. First, you have to have ample amount of air to produce the voice. So that will involve your diaphragm and your lungs producing the air. Next is your voice box. Your voice box should be able to control the vibration, or the flaps should move. It shouldn't be so stiff or so soft so that the vibration, the air from your lungs can cause enough vibration in your larynx or your voice box to produce vocalizations. Next, pa usually requires the lip movement. And it's not just a simple movement. First, you have to purse it, put your lips together, and then the air from your lungs should be able to produce enough force to make a blowing air, so that once it blows, your lips are closed, it will open with the help of the air from your lungs, and then you can produce the pa sound with a burst of the air. Okay, so it involves a lot of movement for just one simple sound, and that is where the problem happens. Okay, so your brain cannot properly execute those series of movements. That's why there is a speech production disorder, wherein someone has trouble saying what he or she wants to say correctly and consistently. So you want to say pa, but when you try to say pa, since you cannot move your lips, the sound comes out as ta or sa. Okay, or if you cannot produce enough air to do a popping sound, you can say ma instead of pa. Okay, so that is what apraxia is. Now, what are the characteristics of apraxia? You can have distorting sounds. For instead of saying bus, one of my child or student with apraxia says butts. So, since it's very difficult for him to produce the S sound, there is a stopping before the S. So, butts. So, that's how he says bus. Okay? There can also be inconsistencies, making inconsistent errors in speech. For today, when we practice the word bus, he says butts. Then, on the second day that we practice bus, he said bush. And on the third day that we practiced bus, he said buzz. So, there were inconsistent errors in speech, even if we are only practicing one word. So that is one characteristic of apraxia. That is how we differentiate it from weakness. or dysarthria because there are inconsistencies to be noted. So you can ask your speech pathologist more to discuss this with you. Next, you could also be groping for sounds. For example, you want to say the word bus, you can say bus. So before you arrive to the word bus, your brain is trying to find the correct sound or the correct placement of your oral structures for you to be able to create or make the word bus. There could also be an error in tone, stress, or rhythm, or what we call as prosody in speech. So instead, when you want to ask, is that a bus? You can say, is that a bus? So it's a monotone instead of having the correct intonation that makes it sound like a question. Is that a bus? So that is also a characteristic of apraxia of speech or AOS. Causes. So definitely, apraxia of speech is very rare to be an isolated case with no underlying issues or associated disabilities. Sometimes, or most of the time, it is actually connected or associated with other developmental disabilities like ASD or autism, communication disorder, and cerebral palsy. There's also an acquired AOS, which can happen anytime and is caused by injury or any illnesses to the brain. If you had a brain surgery, if you had brain tumor, you had brain cancer, you had traumatic brain injury, you had a skull or head surgery, then this can cause apraxia of speech. There is a childhood AOS or childhood apraxia of speech which is present from birth. So these are usually associated with the developmental disabilities as well. So this is not acquired. And it started since the child was young or was born. So again, what to do? First, always consult a professional for proper diagnosis. Why? Your speech and language pathologist will be the one to tell you if it is apraxia or otherwise. There are a lot of speech production disorders, and your speech language pathologist should be able to differentiate whether it is a planning problem, whether it is a weak muscle problem, whether it is a hearing caused by hearing problem, or whether it is a language issue or a mislearning issue. So your speech and language pathologist will be able to help you diagnose or identify if it is indeed apraxia. Then you can have your alternative augmentative communication. Again, if apraxia is in the severe and profound level that communicating through the use of speech is not possible, alternative augmentative communication or other forms of communication be provided like sign language, PEX board or picture exchange communications board, and a Proloco or a app that you can use to communicate using pictures. Definitely, you would need the help of a neurologist because the neurologist can tell, can do tests like CT scan and MRI to tell if there are areas in the brain that are affected or not working properly that is causing the apraxia. You need your special educators to help you to help children with apraxia cope up in the school with limited communication or limited verbal communication. And of course, a multidisciplinary team like the OTs, the behavior therapists, and other people who can help the child cope up in their daily activities with limited communication and speech. So that's it. Thank you again for listening, and support our other social media platforms in Instagram, Facebook, and YouTube. And you can check out our speech therapy materials at Shopee, Talk Club with Teacher Marge.